Hello, my dear students. Welcome to our second class. Today in our class, we will talk about physical development in adolescence. Well, let's just try to remind. We have four main areas of development: ecological map, physical development, cognitive development, and psychosocial development. When you talk about physical development in adolescence, we have to talk necessarily about pubertal changes and the psychological implications of puberty. So, when we talk about puberty, we are talking about the physical changes that occur during adolescence. These physical changes are related mostly with the appearance of secondary sexual characteristics. As you can see, in this line of development, there are many differences that appears in our body through lifespan until we become adults. But during adolescence, more or less from 12 to 18 years old, there are very significant changes in our body, and these changes are related with different social demandings in our life. Puberty is important not exactly only because of what changes in our body, but also because of the expectancies that the others have about what is happening to us. And indeed, the responsibilities and to have to cope with the reactions of the others to our changing bodies is one important challenge of adolescence. That's why the first exercise that I would like you to do for the class of today is to do a brainstorming about some adolescence expressions or thoughts related to that changing bodies. We all know and we all remember about how we felt when we were adolescents and we had pimples or we had hair appearing in our body. So please do a brainstorming about this for us to discuss a little bit about how did you feel when you start to identify that your body was changing in your adolescence? And here we have some of those examples. Puberty is one of these dimensions of our development which is completely biopsychosocial. What this means? When you talk about puberty, there are biological dimensions. Indeed, the changes in our body are related with the maturation and something that is written in our genetic code, but there are also psychological and social dimensions who are interacting with these biological aspects affecting puberty. And indeed, as we will see, both puberty can start earlier or later related to social or psychological dimensions, and on the other hand, these physiological aspects will also affect the psychological dimension of individuals. The biology of puberty is related to some specific aspects. First, at the beginning of adolescence, an acceleration of the growth of the skeletal, but that will start to decrease in middle adolescence. Then there is an increase and redistribution of body fat and the muscle tissue. There is also an increase of strength and endurance, mainly in males, and most important, maturation of secondary sexual characteristics and reproductive organs. As we'll see later, these sexual characteristics in puberty are really particularly important, mostly in girls. Puberty and these biological changes are also including many hormonal changes that occurs during this period. When we talk about puberty and the evolution of these secondary sexual characteristics, usually we use the method of Tanner. The method of Tanner was developed by a gentleman with this name, Tanner already in 1962, but even nowadays we continue to use this typology. And when we think about the evolution of puberty, we can define 5 stages. So during adolescence, we can define 5 pubertal status, and for me it's very important for you to understand the concept of pubertal status, which is related essentially with the development of these 2 characteristics: the appearance of pubic hair in boys and girls, and in the case of girls, with the development of the breasts. When we talk about pubic hair, you can see how it develops in these 5 stages, from a stage of pre-adolescence, in which kids before 12 years old usually doesn't have any pubic hair, and now the pubic hair will develop until we reach the stage 5 in adulthood, in which the pubic hair is surrounding the penis and the vagina of the human being when at the end of adolescence. On the other hand, it's also possible to identify 5 stages in the case of the girls related to development of breasts. Besides the development of pubic hair and the breasts in the girls, it's also possible to identify other aspects in puberty. In the case of the boys, the increase of the testicles is one of the important physical findings. The boys also have a significant increase in the size of the muscles. The voices also change significantly their voices. It's usually to say that the voice of girls breaks around 13 to 14 years old, and the voice of an adult is appearing around 15 years old. Another very important aspect that we will talk a little bit more later is the appearance of menarche and spermarche. In the case of the girls, menarche, and for me it's important for you to keep this concept, menarche is when the girls have the first menstruation. In the case of the boys, spermarche is when the boys have the first ejaculation, when they have sperm for the very first time. It always happens that during adolescence, both boys and girls have an increase in their weight, and the proportions of muscle, fat, and bones change significantly. In this graph, you can see how these different characteristics will develop in the case of girls. As you can see here, the menarche, or the period, the first time that the girls have menstruation, appears between 10 years old and 15 years old in the case of girls. It's also possible to see that the stage 2 of development of breasts is already around 10 years and a half, and the stage 5 is around 14 years and a half. When we talk about pubic hair, it starts around even before 11 years old in the case of girls, and should be completed around 13 years old and a half. In the case of boys, as you can see, the pubic hair starts only around 12 years old, and it will be completed around 14 and a half. This is really important because we will identify one important characteristic, that is the asynchrony between boys and girls. What happens is that puberty usually starts earlier in girls and later in boys. That's why when we think about boys and girls around 12, 13, 14 years old, it's so typical to see that the girls are really tall and very more mature, and the boys really look much more childish. And this is because indeed puberty usually starts earlier in girls than in boys. Besides the puberty status, it's also important to understand how important these sexual characteristics are for boys and for girls. Indeed, in the case of girls, one of the most important aspects is the breast growth. Indeed, the studies are showing that the girls value the fact of having boobies or not, because other people can tell and can notice and talk about that. And even in the social dimensions, usually mothers talk much more about breasts than talk about pubic hair. That's why for girls, usually the development of breasts is something very important. And usually girls consider the breast development as something excite, exciting and a reason for pride. On the other hand, the boys, all the changes related to the secondary sexual characteristics, namely related to testicles, are more private and people doesn't talk that much about it. It's also important to notice that many people associate the menarche or the period as the beginning of puberty, but indeed puberty starts before the menarche. The development of the breasts and the appearance of pubic hair usually starts before the girls have their period. When you talk about the importance that this has for girls, the studies are not consistent. Indeed, there are both positive and negative feelings related to having the period on the girls. Negative related to disgust or not knowing how to deal with this, and positive related to the fact that now I'm feeling a grown up and I'm feeling like a young lady that is already introduced to a new stage of development. In the case of the boys, the sperm mark, that means the first ejaculation, is always usually associated to nocturnal emission and masturbation. Usually the boys have the first ejaculation or because they have what we call a wet dream, and they wake up in the morning with the bed sheets wet, or because they started to do masturbation. Later in another class, we will talk about the importance of masturbation for adolescents. But today I just want you to understand that indeed the first ejaculation is an important moment for boys, and indeed for most of the boys, when it appears without control, some of these boys reported they felt a bit frightened with this experience. When you talk about changes in height and weight, usually boys feel this in a much more positive way. Adolescence is a moment in which girls start to be concerned because they start to get fat and they are very concerned about their weight. On the other hand, boys, they value the fact they have muscles, they are strong, and to be strong is usually associated to be popular and appreciated by girls. As you can see here in this picture, and I think that many of you should remember about this, is the acne or the pimples that we have here. This is another characteristic of adolescence, but there are not much studies about it. So, when we talk about puberty status, we talk about the degree of physical maturation of our body, about breasts, genital, and pubic hair. But I would like to introduce you to another important concept, that is pubertal timing. And attention, and I will ask you to keep this in your mind. Pubertal status is when we talk about the degree of physical development of one specific individual or adolescent. When you talk about pubertal timing, we are talking about the level or degree of physical maturation when comparing with other adolescents with the same age. When we look at these pictures, we can see the three types of pubertal timing. We can talk about average maturer, which is when comparing to other kids of the same age, the adolescent has the pubic hair and the breasts at the same level, or we have a late maturer, which means a boy or a girl that at a specific age, when comparing to other colleagues, the other colleagues are much more matured and with much more pubic hair, for instance, and this specific adolescent still has no pubic hair. So in these adolescents, the puberty will start later. That's why we call them late maturer. On the other hand, we have the early maturer. The early maturer is when we have an adolescent, a boy or a girl, that when compared to other kids of the same age, they look much older. That means that the puberty on them starts earlier. At 12 years old, for instance, a girl, early maturer, already have boobies and already have lots of pubic hair. So, as you can see in this picture, average maturer in the case of girls is around 12 years old, but an average mature in the case of boys is around 14 years old. These concepts of pubertal status and pubertal timing are related to psychological functioning. Let's start for pubertal status. One important aspect is that with time, when our body are changing, there are different cultural expectations for our body. So when we start to look older, people start to expect more from us. So there are changing social roles with pubertal status. The more we are advanced in our pubertal status, more people expect from us, and more we start to have peer pressure to behave as a grown-up. The studies are showing that pubertal status is also related to antisocial behavior. That means that in adolescence, between 12 and 19 years old, more and less, the advanced pubertal status are related to more risk behaviors. So the girls, the higher the pubertal status, that means the more they are developed in their body, they are more at risk of having delinquent behavior, and both boys and girls, they are more at risk of being involved in older and deviant peers. So the period of the adolescence in which kids are more exposed to risk behaviors is when their pubertal status is more advanced. Pubertal status is always also related with emotions, concretely with more negative emotions. So the more the pubertal status, is also expected that both boys and girls are more exposed and at risk to develop depression. When we talk about family functioning, there is no consensus about the effects of pubertal status. Indeed, it is expected that the higher the pubertal status, the higher the conflict in the family. Indeed, many studies are showing that the highest conflict in a family occurs between mother and daughter, not between father and son or father and daughter or mother and son, but the peak of the conflict is exactly between these two ladies, the mother and the daughter, and in the mid-puberty. So when the girl is about 13 to 14 years old, usually a moment in which they are expecting to get much more in autonomy and the mothers are not able to give all. One interest aspect is the relation between pubertal status and cognition. The studies are showing that the development of cognition or intelligence or cognitive skills is more related with age and not with pubertal maturation. So indeed it's not because I am late mature, which means that I started my puberty later, that I'm not as clever as the others. So the cognition and the cognitive maturation is more related with age and not with the pubertal stage. Now let's talk a little bit about pubertal timing and how it is related with adjustment and psychological functioning. The pubertal timing, which means if puberty will start earlier or later, it depends on different genetic and environmental factors. But in general, the idea and what the studies are showing is that early maturing adolescence seems to be at risk. And as we will see later, girls are even more at risk than boys. This means that usually to be an early mature adolescent is a risk factor for development. In the case of girls, indeed, being early mature, which means to start puberty earlier, which means that to be at 11 or 12 years old and already look like she's already 15 or 16 years old is related to the risk of interact more with deviant peers, to bear children earlier, to have more children and abortions in adulthood, to have lower positions in employment. As you can see, these characteristics are showing that early maturing girls are really at risk of development. On the other hand, in the case of the boys, the results are not consistent. In many situations, to be an early maturing boy, that means to be at 12, a boy at 12, but looking like I'm already 15 or 16, this might be related with some advantages, because a boy at 12 feels like I'm stronger and I'm more popular because I look really more powerful than the other boys. However, this is not consistent because there are also cases in which boys who are early mature in terms of puberty, so they are 12 but they look like 14, but if they like to play childhood things, people will look at them and will start to think, hey, come on, this guy already so big and is behaving like a child. Indeed, sometimes in early maturing boys, we have small boys, but with a body of a grown-up, and they start to continue to behave like a small boy, and people feels very strange that they are acting like that, and sometimes they don't react or accept properly this behavior in the early maturing boys. So because of this, we can say that in the case of girls, puberty timing, being early maturing, is related to acting out behavior and to have behavioral problems, to be a bad girl. And I think that is easier for you to understand. You I just told you that puberty starts earlier with girls, which means that at 12, a girl already started the puberty and the boys didn't start. That's why for the girls at 12, 13 years old, they always think that boys are really childish and so small. And girls this age, usually, they look more for older boys because they see themselves more similar um, to boys at 14 years old. So imagine a girl that is early puber. Even more, they will think that the other kids of their age are really childish and they will feel like a grown-up. That's why they start to behave and to try to expect to do the things that older adolescents do. So in this case, early maturing boys and girls, they start to smoke and to drink alcohol earlier than the other ones. Exactly because they are not older, but they look like they start to behave as if they were older because they start to interact with older friends and they start to adopt the same behaviors. That's why early mentoring for boys and girls is a risk factor because they might be included in more risk behavior. That's why, as you can see here, early mentoring girls report to have more negative emotions, including more depressive symptoms, and on the opposite, later maturation in boys, that means that boys who are already 14 or 15 but they look like they have 12 or 13, they have lower achievement, lower self-esteem, and less confidence. When we think about puberty timing and body image, the results are not consistent too. We can have early maturing girls not satisfied with their body and appearance, but these results are not consistent. What usually is consistent is the idea that boys who are maturing later, which means a boy at 15 or 16 but is skinny, thin, small, short, they feel not satisfied with their body because they were expecting to be stronger, um, and to look like they are bigger and strong to the others. Uh, as I told you, in general, when we think about psychopathology, early timing of puberty in girls and late timing in boys is related with psychopathology. So to be early mature is a risk factor for girls, and to be a late mature might be a risk factor for boys. But this doesn't have to be. When we talk about cognition, specifically about school grades, the studies are showing that usually early matures boys have higher grades than late maturers, and in the case of the girls is exactly the opposite. The late mature girls have highest grade, and I think that you can understand that. The early mature girls, they are more involved in social activities and in risk behaviors like smoking and drinking alcohol with elder peers, and the late matures, those girls who start puberty later, because they are not involved in this kind of activities, they are more involved in academic activities. Indeed, as you can see, pubertal timing is very important for development. And there are two explanations for this, and both explanations make sense. The first one is the maturational deviance hypothesis. What this means? That means that when we are early mature or late mature, in one way or another, we feel different from the average. And this sensation of feeling different might expose us to specific risks. the sensation that I don't belong, and I don't know exactly how to fit in my group. But another one, and eventually even more important, is the timing hypothesis. What this means? This means that eventually, mostly for early maturational girls, for those whose puberty will start earlier, maybe the problem is that they didn't have time to adapt to the changes. Suddenly, after, in few weeks, in few months, I don't look anymore as a child, and I look like a young lady. And the boys, men, people around me starts to looking at me in a different way. And when they look at me in a different way, they expect different behaviors from me. So what the hypothesis that we have here is that early mature adolescents, mainly girls, they didn't have enough time to know how to deal with their bodies, and how to react and adapt to the expectations of the others towards their different. That's why we can make the hypothesis that adolescents who are off of time, or earlier or later, they can experience and feel more stress than adolescents who are in average, because they are outside of what is expecting for them. This early maturational hypothesis is especially disadvantage for girls, because early maturers girls have less time and are less experienced, and they to solve the challenges and what is expecting for them appearing like adults. Is exactly this idea. They look like grown-ups, but in terms of emotions, they are not prepared to deal with that. In the family, as you can also imagine, uh, early maturation is related with more problems and conflicts and externalizing behavior. Indeed, when adolescents are early puber, they have more conflicts, and they have more start to demand more from their parents. A study made with girls from the university, asking them about their experiences as adolescents, showed that to be earlier mature, or to have the menarche or the period earlier, was related with family stress in late childhood. That means that children, girls who experience strong stress in the family, they can have the period earlier. And when there is a strong conflict with the mother, also around age 6, this also can be related to have the menarche earlier. And they also show that the girls who had the menarche earlier, they start to date earlier, and they had more boyfriends than the other girls. On the other hand, the studies are showing also that early maturing boys and girls, they have more interaction with friends. Here's exactly what I told you before. When they are early maturing, they value more social interaction, usually with older peers, and that's why they involve in more deviant and risk behaviors. When they are younger, when they are late maturer, they are not that involved in social activities, and they can focus more in academic activities. That's why they also usually have better academic. Another study with girls in the 7th grade are showing that early mature girls, they have a poor self-image, and also that they are more involved and exposed to deviant peers and in disruptive behaviors in adolescence. Finally, a study with African American girls also showed that these early mature girls are more involved with deviant. Another important aspect in adolescence is related to the hormones. And one important hormone in adolescence is the testosterone. The testosterone is one hormone that is more prevalent and appears in higher quantity in boys, and it's related to antisocial behavior and aggressive behavior with low tolerance to frustration, to be more irritable and impatient, and to substance use. So the levels of testosterone in boys are associated also with many negative development. So, based on this, I will finish this class asking you to do a last exercise. This exercise involves two aspects. One that is very easy is to ask you what is your pubertal status, and this is easy, I hope. But the most important, this second question, which was your pubertal timing? So I want you to think about when you were around 12, 13 years old. And I would like you to tell me if you were an early puber, which means if your puberty started earlier, or if you were a late puber, if your puberty started later, and or if you were an average puber, if you were more or less the same as the other friends. And based on that, I would like you to reflect and think a little bit in which way being early, average, or late puber affected your life or your development. And with this exercise, I finish this class, and I hope to see you on Monday and that all of you have the assignments prepared. Bye bye, my dear students. See you on Monday.